So, autonomous AI with agents, they're able to layer tasks and really act autonomously. And we know that in the health and human services space, it requires a little more thought and care because we're dealing with society's most vulnerable folks. So, what are some of the things that you need to consider, especially in this space? A good example, my home state of Illinois recently passed the first law that governs and restricts the use of AI in therapeutic settings. So being aware of those regulatory and compliance considerations. Policies and procedures. How are you guiding and informing your staff about the appropriate use of AI? How do you best inform people that they're interacting with AI? All of those things come into play. And for your staff, the reality is they are using it anyway. So it's important that you get those policies and procedures in place because without those, people are going to be doing it cautiously. They may be telling their friends and they start using it, right? In particular, if those platforms that they're using aren't secure, they run the risk of your client data or your own intellectual property being out there for public consumption. And then what training is needed once you get those policies and procedures in place? How are you making them available to your staff? How are you training them in the use case? How are you letting them know what to look for? So we talked about AI being an entry-level employee, and that's fine, but supervising an AI member of the AI workforce is very different than supervising your human intern down the block, right? The way in which you have to give them instructions differs. The way in which you need to monitor them and teach them and coach them is different as well. Who is your audience? You're going to have very different reaction among your clients to the use of AI if you are dealing with a primarily teen audience, right? Versus you've got an adult day program for senior citizens. We know that certain segments of our population would much rather talk to an AI agent than they would talk to a member of your staff. So, how are we meeting them where they are? So, that's another consideration. So, I know it's a lot, right? I just put all of these challenges in front of you, all of these things that you need to consider, and you may be feeling overwhelmed, but the potential payoffs are huge.